Infants and children cannot, unfortunately, receive this vaccine since it has not been tested in children of that age. The Pfizer vaccine has been approved in teenagers 16 and older. However, the Moderna vaccine is only approved for kids or teenagers 18 years and older. Pfizer, however, is presently leading studies to test their vaccine in children between the ages of 12 and 16 with hopeful data to allow it to be given to teenagers as young as 12. We know that fortunately, COVID-19 doesn't infect kids with as severity as it does in older or young adults, but it is still very important that we do find a vaccine that's safe for children, because children can be vectors and continue to spread the virus to other people who are more at risk. Now, as for pregnant women and breastfeeding mothers, the vaccines, both of them, have not yet been approved through studies. However, one has to take into consideration the individual situation. For example, if you are a nurse who's pregnant and who works in a high-risk environment, such as an ICU nurse or a long-term facility nurse, and you are actively treating and looking after patients day in and day out who are COVID positive, who are intubated, and you're giving them treatments, you are in a high-risk situation. And in a situation like that, it is probably far safer for you to be protected with this vaccine than for you to expose yourself and your unborn fetus to contracting the illness, which we know can be deadly to both of you. So those particular situations in pregnant women or breastfeeding mothers can be very individualized, and it's important to take those individual situations case by case and to discuss it with your family doctor or your obstetrician.
Great, that is wonderful. Dr. Shikawi just wanted to add 30 seconds, one more thing about pregnancy, and then I'm going to invite Dr. Salimi to address the next question. Go ahead, Dr. Shikawi.
Jazakallah. So one thing that I wanted to just clarify is a lot of the concern around the safety of vaccines in pregnancy relates to the mechanism of the vaccine. And most of the vaccines that we worry about potentially being unsafe in women who are pregnant are live vaccines, which means that there's a portion of the vaccine that is actually made up of live virus, and then that could trigger an adverse response. The good news is most of the vaccine frontrunners we're using for COVID-19 are killed vaccines. And so the likelihood of them causing a serious safety issue in pregnant women is extremely small, if not likely to be negligible.